Okay, so firstly, my name is Jennifer Lewin. I'm really happy to be here with you guys today. We're going to talk about hormones. We're going to talk about, this is probably truthfully the broadest talk I've ever done. It's going to encompass a lot of different pieces, and I'm going to really try to weave together kind of a story for you guys of how I think about and how I work with hormones in this very kind of multidimensional, multiplanar way. Okay, so a little bit about me. I've been a practicing therapist for about over 25 years now, so a really long time. My professional licensure is I'm an acupuncturist and herbalist. I trained in the US. I've worked a lot of my career in Asia, both in Hong Kong, and I've been in Singapore for now coming on about 6 years, so coming to the end of my 5th year. I have a master's degree in TCM, Chinese medicine, acupuncture, herbal medicine, as well as Japanese acupuncture. And I am a functional medicine practitioner, which within the context of this talk, that's really going to be the focus, thinking about functional medicine, root cause medicine, and how I integrate kind of that into working with hormones. I specialize in nutrition and working with just overall nutritional wellness programs. And I also do a lot of like very gentle hands-on manipulative work. And I kind of weave together these various modalities in my clinical care and my practice. But again, today, the focus from a hormonal perspective is I'm going to really share my thoughts and clinical experience in how I think about hormones, really from a functional medicine, kind of from a root cause medicine perspective. So I want to share with you my clinical experience. That's when I'm thinking about goals for this talk. I've been working with women, men, children for 2.5 decades. So I have lots of kind of clinical experience and clinical expertise in weaving together kind of hormonal stories for patients. I want to really relay to everyone an understanding of root cause medicine as it relates to hormones and hormone imbalances, and thinking about how do we really optimize hormones for each one of us, given where we're at in life and our age and whatnot. I want to also, again, I'm going to give a very broad overview in this talk of kind of key hormones and the key areas that we absolutely 100% have to get right. So most of my talks, truthfully, are kind of a deep dive into a much narrower topic. So even within hormones, thinking about just for women or just perimenopause or just menopause, I've been wanting to do this talk for a while that was just kind of much more broader strokes. So thinking about, again, from a very broad perspective, what are the absolute key hormones that we have to get right, and kind of the ways I'm thinking about that, okay? Kind of the interconnectedness through the themes that I see over and over and over again with patients as to kind of what goes wrong and how we can fix that. Okay, so, and then I'm also gonna really emphasize kind of what can we start to do about this? So thinking about nutrition, thinking about kind of all the things that make up lifestyle medicine. Nutrition, maybe supplementation, things like sleep and movement and exercise and stress management, community. So all those things, what can we do to support hormones? Okay, so what is a hormone? A hormone is really, you can think about it as like a messenger molecule. So within the realm of hormones, we can think about that as like part of our communication system. So how the body communicates with each other. And a hormone is a little compound that oftentimes is transported through blood or other fluids and is going to lead to some sort of action in the body. So it's made in one part of the body and then it travels throughout the body to have some sort of an effect in the body. It's also really important to understand that the brain plays a really fundamental role in the feedback and regulating the levels of hormones. So the brain, for many hormones, not all, but many hormones work on what's called a negative feedback loop. So the brain's going to monitor what's going on hormonally in the body, and based on what it sees, it's going to maybe say make more of that hormone or make less of that hormone. So the brain creates this communication system throughout the body where it helps with our regulation of hormones. So the brain plays a very, very important role, this feedback between the brain and the body, and especially two parts of the brain called the hypothalamus and the pituitary gland. So we're going to talk about those kind of throughout, especially in the context when we're thinking about the adrenals and stress management. Maybe some of you have heard something called the HPA axis, which is the hypothalamus, pituitary, adrenal axis. So there's other HP axes in the body, but we're definitely going to talk about the brain. So we need to understand that the brain plays this really important role with hormones. So the brain often, if we think about something like thyroid hormone, the brain, the hypothalamus will let out thyrotropin releasing hormone when it has monitored and knows that we need more thyroid hormone. Then the pituitary lets out something called thyroid stimulating hormone, which if any of you have done basic blood work around your thyroid, you would have gotten TSH checked in your blood. It's probably one of the most common, but that hormone is really a brain hormone. It's coming from the pituitary gland. And the way I think about it is kind of how loudly does the brain have to yell at the thyroid to tell it to make more thyroid hormone? That's kind of, I think of TSH as like a dial. Is it speaking really, really quietly, or is it having to yell at the thyroid to tell it to make more thyroid hormone, or is it kind of within the right range? And then the thyroid gland starts to produce the precursor hormone to active thyroid hormone, which is T4, and then which has to eventually get converted. So just to understand that making hormones is this multi-step process where the brain plays this very important role. All right, so I want to talk now, I want to get into just the functional medicine model and what that means. Just to note, if you have questions, please just put them down in the chat box and I will get to them. If it's appropriate within the context of the talk, I will absolutely get to them. And if not, then I will get to them at the end of the talk, okay? So that's probably the best way. So I love questions. Because I think a lot of the people who listen to my talks are quite savvy and very just into health and wellness. So I have just really, really intelligent questions. So I'm sure if you have a question, someone else probably has the same question. So please do ask them. And again, I will definitely get to them either within the body of the talk or at the end. Okay, I want people to understand what functional medicine is. When I say functional medicine, what I mean is thinking about whatever's going on in your body from a root cause medicine perspective. So someone like me who practices functional medicine, I'm gonna do a very thorough case history to get a sense of what someone's signs and symptoms are. And then I'm gonna overlay that with all sorts of objective markers where I'm looking to identify what the underlying root causes are. So I'm gonna look across systems. I'm going to think about what's going on gut and digestion and with the microbiome. I'm going to think about what's going on with the immune system. Is there a big inflammatory picture? Is the immune system upregulated or downregulated? I'm going to think about detoxification and what's going on there. Detox is a really big deal when we think about hormones because hormones need to be made, but hormones really also need to be broken down in the right way, down the right pathways. So we are going to talk about detox a decent amount in the context of hormones. Energy production, so the mitochondrial system. So do we have enough, are we making enough cellular energy to kind of fuel our body? Hormones and neurotransmitters, so that's again the whole topic, the communication systems in the body. That's kind of the broader topic of what we're speaking about today. And then I'm thinking about, are there structural issues with the anatomy, lack of blood flow in and out of the area, a liver that's sick, a cardiovascular system that's sick. And then I'm thinking about lifestyle practices, what's going on vis-a-vis diet, sleep, exercise and movement, stress management, community. So all these things are taken into account when we think about this broader umbrella of functional medicine and what's going on from an underlying root cause that's driving somebody's signs and symptoms. And then I'm going to implement an individualized treatment protocol. So everyone's treatment protocol looks slightly different based on what they have going on and based on what I'm picking up, both from their case history and objectively. So this is how, when I think about, or when I'm saying I looked objectively at a patient, I'm looking at a lot of what would be considered kind of Western medical ways of assessing the body. So I'm looking at blood markers. There's all sorts of things that I can look at in blood that give me a really good sense of what's going on in the body. That might be things like, is the person anemic or iron deficient? What are their vitamin D levels like? Is their liver working well? Are their kidneys working well? Do they have high levels of things like cholesterol or triglycerides? What's going on blood sugar and insulin wise? And some hormones are quite well looked at in blood. So thyroid hormone in particular, I always want to do a full thyroid panel. I'm thinking about things like estrogen, progesterone, testosterone. So, and things like DHEA, sulfate, one form of DHEA that's tested through the blood. So I can look at certain things. Blood work gives me kind of a moment in time, but it's a very important kind of baseline assessment that I'll do with all patients. And then based on what someone has going on, I'm absolutely going to look at gut and digestion through an advanced stool panel, quite different than like a regular run-of-the-mill stool panel at your doctor. So we'll go into that a little bit. Again, gut's a very important piece with hormones. I'm going to talk a lot about what's called a Dutch panel. Dutch is an acronym for the Dry Urine Test for Comprehensive Hormones. And it's probably the most sophisticated way today in the functional medicine world to look at our sex hormones, how we break down our hormones, our stress hormone, our cortisol, and melatonin. And then there's various other tests. If I'm thinking more about underlying infection, if I'm thinking more about toxicity, if I'm wanting to know someone's genetics and their genetic predispositions, because I think it's going to kind of lend to the clinical case. If I'm thinking about kind of food intolerances, if I'm thinking about toxic load, maybe like mold, heavy metals, mycotoxins. So all of these things are assessed very nicely using various types of functional medicine-based lab tests. All right, so let's get into kind of what we're going to think about and what we're going to really focus on in this talk. So the 4 hormones that I'm really going to talk about the most during this talk and consider are going to be insulin, cortisol, which is one of your important stress hormones, thyroid hormones, especially TSH, free T3, and free T4, and sex hormones, estrogen, progesterone, testosterone. There are lots of other hormones to consider. Other really important ones that I think about and I look at and I work with based on what's going on are things like melatonin, things like DHEA, which both of those two are going to be on the same hormone panel that I'm going to look at estrogen, progesterone, testosterone with, but I'm just not going to get in depth in the context of this talk. Again, I could probably do 10 talks out of this one talk if I got a little bit more granular and into the details. But again, I want for people to get just this broad overview of how I'm thinking about hormones and their interconnectedness. And then there's other important hormones, things like leptin, which regulates fat and satiety, and things like ghrelin, which is our hunger hormone. So again, lots of different hormones to think about. The 4 categories we're really going to focus on today are the top 4 though. And sorry, one more thing here, just to know that everything kind of affects everything else here. So issues with one hormone are going to drive dysfunctions with other hormones, which is why, again, I think giving this overview of this interconnectedness can be really valuable. And then again, when I'm thinking about hormones, even if someone comes to me with menstrual problems, let's say, or sex hormone problems, low libido, or if a man comes with kind of erectile dysfunction or, something going on with sex hormones, I'm going to always want to think about and assess these guys down here first. I want to get sleep right. I want to get blood sugar and insulin right. I potentially want to get gut right. I want to think about inflammation and infection. And then I also want to think about thyroid and adrenals. So oftentimes there's kind of a hierarchy, and it's not always exactly like this. Sometimes thyroid is the biggest driver. Sometimes adrenals are the biggest driver. But, again, just as a gross generalization, I think this triangle is just a helpful visual to get. Okay, so when we're thinking about hormones, a lot of hormones have a circadian rhythm or a cycle. So women who menstruate know very well that periods happen very cyclically, that there's a cycle to it. But melatonin happens cyclically. Cortisol, we have our stress hormone, as I'll go through and we get into that area, has a daily cycle. And we want to get these cycles right to have kind of for our hormones to be more optimal and work better for us. We want our hormonal system to have a lot of give in it so it can adapt to our environment really well. I think when people are their hormones don't have a lot of give, and you see kind of across the board various types of hormonal dysfunction, the adaptive nature of our bodies just becomes much more difficult. So we end up with having a bunch of signs and symptoms if our bodies can't adapt appropriately through this hormonal system. So it's also important to note that there's certain hormonal times that are just so important. So puberty would be kind of the first one in the lives of our children, our young people. Oftentimes puberty can start early. Oftentimes we're seeing it closer to 10 to 13 years old or so, but some people go into earlier puberty starting around 8-ish, and some people have later puberties. So this is going to be the period in life where all of a sudden children get these huge hormonal surges. So it's really important, as we're going to think about for our teenagers, if you're seeing hormonal symptoms in your teenager, you want to think about all the different things that I'm going to talk about today. What's going on with their blood sugar? What's going on with their stress hormones? What's going on with their gut? What's going on with their detox? Are they nutrient deficient? Because if they're not breezing through with, of course, they're going to have some ups and downs with these hormonal surges, but if they're having persistent signs and symptoms, we want to support our children through these times. Women, because of the cyclic nature of menstruation, and because of women go from whenever they get their periods, let's call it the young 11 to 14, 15, most girls are having their periods, through about their mid-30s are having somewhat regular cycles. I'll talk about a little bit also, really our cycles don't establish themselves to our very late teens, early 20s. So I'll talk about that a little bit when I get into talking a little bit more about some of the teenage things to consider. But women go into what's called perimenopause. I think about this as the ovaries go into retirement really, really slowly over a number of years. So starting in the mid-30s through, for most women, to their late 40s, early 50s, when we go into menopause, there's a period called perimenopause, the time before menopause. And there's some important considerations to think about during that time. That's not going to be the focus. Menopause is not going to be the focus of this talk, but I'm definitely going to talk about some things that are important during that time, because you got to get, again, some of these things that you've just got to get right in order to get overall hormones right. It's even more important to get your adrenals right as we move into perimenopause, our insulin right as we move into perimenopause, our detox right as we move into perimenopause. So things just for women especially become more important as we move through perimenopause into menopause. So again, there's daily cycles, there's monthly cycles. For women, we also have things like pregnancy to think about, fertility treatments. For men and women also, there's things like, hormone replacement therapy, which again, I'm not going to really get into in a huge amount, but I will speak to it very broadly. And then there's things like insulin, the hormone insulin, which is going to be the first hormone that I'm really going to discuss here. Insulin is really largely based on diet and lifestyle, our insulin levels. So that's not, there are cycles, but it's much easier to control that through kind of getting our diet right. Okay, so the key hormones that we're going to assess and address that I'm going to emphasize today are insulin and blood sugar, adrenals and stress hormone, in particular cortisol, thyroid hormones, sex hormones, and then the last three kind of main areas, the nutrient deficiencies, the gut and digestion, and the detox. If we don't get these right, it's so hard to get the rest of these right. So there's kind of 7 broad areas that I'm going to go through today. Know that, again, these patterns are not mutually exclusive. It's very common to have, 2 or 5 or all 7 of these as issues, as underlying issues that we need to think about. And then also know that inflammation is a part of every pattern. So I'm not going to talk so much about inflammation on its own, because I do kind of whole talks on how do you work with inflammation, how do you adjust diet around inflammation, how do you adjust kind of lifestyle around inflammation? But just know that it is a part of every pattern. Okay, so let's get into insulin and blood sugar. So insulin is like the key that brings glucose or sugar into the cell to be utilized. So sugar is floating around in the bloodstream. We've consumed glucose, or glucose gets let out from the liver, stored glucose, goes into the bloodstream. In order to get into the cell to be utilized, you need insulin to unlock the door of the cell. It's like the key to let sugar in. So insulin's really important. And know that every time we eat sugars and carbs, we need an insulin surge because we need to do something with that sugar. So carbs and sugar go up, we're going to get an insulin surge. What happens if you have too much insulin around for too long because of too much blood sugar and too many, maybe of the wrong types of carbohydrates that you're eating? Eventually cells can become resistant to insulin. So that's when we talk about people having an insulin sensitivity issue. And then it's like the key doesn't want to unlock the door, or it's like, someone's used the analogy before that I think is also a good one, that it's like you have a suitcase that's really, really stuffed and you just can't fit anything else in because there's so much carbs and sugar hanging around that it's like you just can't close the suitcase properly. So when we have these long-term states of high blood sugar, which require high insulin, this contributes to any and all types of hormone dysfunction, from sex hormone dysfunction, in particular polycystic ovary syndrome, estrogen dominance, which we can see in men and women, thyroid dysfunction, either too much or too little thyroid dysfunction, thyroid hormone. The adrenal and cortisol issues can be driven by insulin because it is a major stressor to have blood sugar bouncing all over the place. This is called dysglycemia. It's such a major stressor to have blood sugar issues and to have insulin issues. Certainly melatonin and sleep issues are greatly affected by insulin and blood sugar. A lot of people are waking up in the middle of the night because they're having a blood sugar crash. Other people are waking up in the morning and their brain's not switching on properly. They're not getting this, what's called a cortisol awakening response. Cortisol is supposed to help us switch our brain on in the morning. So that's those people who need to run for coffee as soon as they get out of bed to help them turn their brain on. That could be driven by insulin and blood sugar issues throughout the night. That's one of a number of things which could be driving that. Also hunger and satiety hormones, things like leptin and ghrelin. When we have insulin and blood sugar issues, it's very common for leptin and ghrelin to also be dysregulated. Okay, so when we're eating maybe too many of the wrong types of carbs, certainly your processed refined, things like high fructose corn syrup that are in all our sodas, and kind of the industrial food industry has not done us any favors, and they've done us, in fact, a huge disservice by what they put into our kind of packaged and processed foods. And, one of the problems that's come out of this is dysglycemia, just dysregulation of blood sugar, where we're kind of popping up and down all the time. So we really need to make dietary and lifestyle changes to regulate around insulin and blood sugar. So we want to monitor. We want to have an objective view as to what's going on with an individual, which we can absolutely start with basic blood work. Things like fasting insulin, fasting glucose, and a marker called hemoglobin H1C. Lots of regular conventional doctors will test fasting glucose. That is one of the last markers that's going to go off. So in my opinion, everyone should be asking for a fasting insulin and a hemoglobin A1C. They're markers that tend to go off before fasting glucose goes off in our bloods, and they're not particularly expensive, and they're very easy to get run. So those would be really good places to start to get a sense of, after an overnight fast, is your insulin dropping to appropriate levels? Is your glucose dropping to appropriate levels? Or do you have lots of it still hanging around even after quite a long overnight fast? And then there's something called a CGM, which I'm just going to switch over to this next slide. A CGM is a continuous glucose monitor. So in the US, you need to get a CGM prescribed by a doctor. In Singapore and Hong Kong, where I've worked again for many years, you can go to Watson's or Guardian and you can buy a CGM. You can attach the app to your phone. I like the Abbott Freestyle Libra, but there's a handful of good ones. This one's readily available. You can buy it off of Amazon or, again, Watson's or Guardian, and you wear it for 2 weeks and you start to monitor objectively what's giving you blood sugar spikes. So this is to monitor glucose, not insulin. So it's a really amazing, just N of one, I'm looking objectively at myself and I'm looking at what is spiking my blood sugar. What in my daily life? Is it certain foods? Is it lack of sleep? Is it stress? Is it, when I exercise versus when I don't exercise? Is it when I drink alcohol versus when I don't drink so much? Is it when I have, a snack before I go to bed? Is it when I skip breakfast? So again, it's this really amazing kind of tool just to get information on yourself that's available to everyone. So someone's asked me the rough cost. I believe in Singapore, it's like 80 to 100 Sing dollars. So somewhere around that range, but it's a really valuable tool. And then some dietary things just to start to think about, like some actionable items. If we want to start to think about insulin and blood sugar, think about starting your day out with avoiding a big carbohydrate meal. So think about doing like proteins, fats, veggies. Those are much better ways to start out the day because they don't require the same type of insulin spike. So avoiding carbs for breakfast, so we don't require this massive insulin spike in the morning, can be a really great way, one, to balance insulin throughout the day and blood sugar, but two, to balance stress hormone. Because anything that requires, so like sugary cereals, pastries, like all these kind of very high carb breakfasts just don't do us favors when we're thinking about insulin, blood sugar, and stress hormone. Because again, this kind of up and down, trying to avoid this big blood sugar spike in the morning where you might get a drop it's a really great nutritional strategy to help balance blood sugar and stress hormone and insulin throughout the day. And then think about the types of carbs you're eating. If we eat more high fiber carbs, things like our sweet potatoes and our root vegetables and our pumpkins and our squashes, these are like, they're slow burning. The uptake of the blood sugar the uptake of the glucose into the bloodstream in the environment of fiber happens much slower. So especially if we bring these in at night, it can be a great strategy to help with sleep if you're waking up in the middle of the night. Because a lot of people are waking up actually because they're getting a blood sugar drop because they've eaten the wrong kind of carbs for dinner. These kind of like more fast burning carbs where the uptake is fast, you get a big blood sugar spike and then you drop down. So we want to try and avoid that. So in general, I try and have people focus more on these high fiber, slow burning carbs throughout the day for lunch and dinner, ideally not too many for breakfast. And then also the other thing that you can do kind of vis-a-vis blood sugar, besides again, thinking about what you eat before you eat your carbs, is moving after your meal. So if you are going to have a big high fiber meal, like go for a walk after, get up and dance, do like, just move, get up and move. And then we want to, even in the context of when we're eating carbs, ideally, we're going to start out with eating protein, eating fiber, like veggies, and maybe having some vinegar. Everything but like the sweet balsamic vinegars will do. So if we start out our meal, like going for the bread basket is never the right way to start out your meal. Start out with like a salad or, a vegetable antipasta with some oil and vinegar with maybe some protein on it. Like that's such a great way. So I'm always telling my kids, you can have your carbs, but you got to eat your protein and your fiber first. So I want them to eat their protein, eat their veggies. And then when they get to their carbs, the uptake of that carbohydrate into the bloodstream is just not going to be so fast. It's going to be much, much slower because I have other things to slow down the uptake. So just one more quick note on this is, I know oat milk is a really big thing today, but I can't tell you how many patients come to see me and tell me they can't believe what a big blood sugar spike they've had on their continuous glucose monitor after like an oat milk latte or an oat milk, tea or something. And it's because we've taken all the fiber out of the oat. And so the uptake of the carb, of the glucose into the bloodstream is so fast. And so it's kind of like drinking a glass of orange juice. It's like, for me, oat milk is just, it's like kind of a joke of a health food that's being touted as a health food. For people who can tolerate dairy, most of the time I would much rather them have that, because that dairy, especially full fat dairy, is, at least full of fat and has some protein. You're not going to get these blood sugar and insulin spikes like you will with something like oat milk. Okay. So let's go on to topic number 2, which is adrenal and stress. So besides getting insulin right, we really want to get adrenal and stress hormone right when we're thinking about the overall hormonal landscape. This is for men, this is for women, this is for our teenagers and our children. So, teenagers and children, those external stressors, those life stressors are probably going to be more school, maybe family life, hopefully not though, and social. Those are kind of big stressors for teenagers. For external stressors, when I'm thinking about these external stressors, we'll talk in a minute about internal stressors. External stressors, for a lot of adults, are they happy in their job? Are they happy in their marriage or their relationship? Are they happy financially, what's going on? Are they doing something in life that brings them joy and like fills their bucket? Or is it feel really depleting what you've chosen to do, for your job or professionally, or to, what's going on with, kids, what's going on with aging parents, what's going on kind of broader family-wise. So those are all the external stressors. Sometimes we don't have a lot of control over those external stressors. Where we can make changes, it's always a good idea to do that if you feel like you have control over that. Where someone like me really focuses from a clinical perspective are on these internal stressors. So a lot of what I'm talking about today in the context of hormones are, let's help assess, so identify and address or treat internal stressors. So internal stressors, examples of them would be, is someone anemic? Do they not have enough iron? Is someone having these blood sugar fluctuations? Do they have dysglycemia or insulin issues? Are they really inflamed? Is it, do they have a toxic load? Do they have an infectious load? Are they eating foods that are not right for them? What's, again, kind of the driver of the inflammation? Do they have gut and digestive issues? Do they have hormonal issues? Kind of when we get into thinking about estrogen, progesterone, testosterone, do they have kind of too much of one or too little of one? Or are they over converting something into, so testosterone, for instance, through a process called aromatization, gets turned into estrogen. So, are they over aromatizing? So thinking about that for certain women, but a lot for men. When we think about our men who have, man boobs is like a very kind of obvious clinical sign that we can think about and look for. But if a man has that body morphology, I'm starting to think about, do they have kind of too much estrogen? Are they overproducing their testosterone into estrogens? And that's a stressor. All of these things are internal stressors. Are we not breaking down our hormones down the right pathways? There's certain estrogens that are like fertilizer for not great things to happen in the body, and those are stressors. So making sure our adrenals are well taken care of is really, really important. So when we have too much of the wrong kind of stressors, internal or external, the brain and the adrenals stop communicating as well. And the adrenals can get taxed, or you can have, adrenal insufficiency. So you can have too much cortisol, or you can have too little cortisol. And either of those states can contribute to all sorts of other hormone dysfunction. So again, everything kind of piggybacks off of everything else, which is, again, thinking about this interconnectedness that I'm trying to paint this picture for you guys. So adrenal stress issues contribute to thyroid, contribute to sex hormone dysfunction, contribute to autoimmunity, which is such a big deal, certainly within the context of thyroid hormone dysfunction, but just in general. I mean, a lot of people have autoimmune diseases, whether it's thyroid, whether it's celiac disease, whether it's something like psoriasis, whether it's multiple sclerosis, whether it's, so again, there's so many different types of autoimmune. Rheumatoid arthritis is a big one that I see, where the body's attacking its own joints. So issues here also greatly affect sleep and sleep hormone dysregulation and blood sugar and insulin. Okay, so let's think about cortisol. So cortisol is the stress hormone that's decently easy to assess on a Dutch panel. So this dried urine test for comprehensive hormone that I'm going to talk you through. And when we think about stress hormone, usually happens. So if you enter a room, or you pick up your phone, or you get a phone call, and it's a stressful situation on hand. So epinephrine and norepinephrine, also called adrenaline and noradrenaline, are released within seconds. So those are kind of your immediate type stress hormones. Cortisol may take maybe 10 minutes or so to kick in, but people who are burning the candle at both ends, they're working crazy hours, they're not eating properly, their blood sugar's all over the place, they've got super stress, they're burning the candle at both ends. We all know those people. We ourselves sometimes are those people, or have been those people. Really common for it to happen from teenage years into university, into our 20s, and you have some give in your system when you're young. Not everyone, depending on kind of what you have going on. I see lots of teenagers who don't have that much give in their system, and lots of people in their 20s. But a lot of us can do that for a certain amount of years, and then life catches up with you. So a lot of people start to have issues maybe in their 30s, maybe in their 40s, certainly in their 50s. That's common. We think of it as like, oh, we're just aging. But so much of this we have control over. Excuse me for a second, I'll have a sip of water. So when we put ourselves in a chronic stress state, and we're burning the candle at both ends, the adrenals initially will overproduce cortisol. We'll have too much cortisol, maybe too much cortisol at the wrong time of day. We're supposed to not have very much at the end of the day, but maybe someone has a big cortisol spike at the end of the day and then they can't sleep. Long term, the body generally cannot sustain a high cortisol state forever. So eventually we start underproducing cortisol. So cortisol has a rhythm. So I'm going to show you in a minute this diurnal or daily rhythm of cortisol, what it should look like and what it can look like when it's in dysfunction. We also have, and I alluded to this before, this cortisol awakening response. So cortisol helps switch our brain on in the morning. We want to have a surge of cortisol in the morning to switch us on. So there's a way to look at this through the Dutch panel, and there's a specific cortisol awakening response kind of add-on to the Dutch panel, which I'll run on some people if I really want to see specifically what's going on. And our cortisol awakening response, we can all kind of think about it as almost like a little report card, a mini report card as to what's going on with our HPA axis brain, from the hypothalamus talking to the pituitary in the brain, talking to the adrenals. So again, these people who have to run for coffee to switch their brain on in the morning, that is a very clear indication that you have cortisol dysregulation and you don't have an appropriate cortisol awakening response. Now, cortisol is also anti-inflammatory. So sometimes our body upregulates cortisol short term. We get a burst of it in order to modulate the immune system. I see this sometimes on labs with autoimmune patients, or maybe I'm looking at the person super fatigued, but maybe they just had a flare, and they're gonna look like high cortisol because cortisol is trying to kind of quell the fire of inflammation in a system in the body. So we kind of want to get a sense of what's driving our cortisol production, our cortisol clearance. We want to make sure we can clear cortisol. And then are we getting the cortisol curve right? Is the timing, is cortisol surge happening in the right time? Excuse me. Is low cortisol happening at the right time? Okay, so this is kind of 4 different examples here of what can happen with a cortisol curve. So we want to start out this first baseline cortisol assessment. Our waking cortisol is kind of an indication of what was going on through the night. So sometimes it's super, super low, sometimes it's kind of in the middle, and sometimes it's too high if you had a cortisol surge in the middle of the night. So, this first one, and then within 2 hours after we wake, so this is a 2-hour after waking cortisol sample, this is when our cortisol awakening response happens. So do we get an appropriate bump in the first 2 hours upon waking? Really, it's mostly within the first 30 to 60 minutes of waking, but this sample on the Dutch test gives us a sense. So this person, they are at okay levels. They're kind of within, this is high end of normal, low end of normal. So they're at the lower end of, but still within normal upon waking. They're getting a nice rise up 2 hours after they wake. So this person looks like they have a decent cortisol awakening response. Then they want to slowly, as they go down, this sample is done at about 5 p.m. and this one's done before bed. So I want to make my way down in the afternoon. And then this person goes up slightly at night, which is not ideal, but this was kind of the closest I could find that looks like a somewhat normal diurnal curve. This would be even better if they were lower than, if D sample was lower than the C. And then what we test in saliva, the old way of looking at adrenals was through saliva. We will look at free cortisol, but this only represents about 1% of the cortisol. What's amazing about Dutch, how Dutch has revolutionized the world of adrenal assessments, is by adding in metabolized cortisol. So in urine, we can see the breakdown products of all the cortisol, not all, but about 80% of the cortisol production that we make in our body. So this person, their free cortisol and their metabolized cortisol, they're pointing in the same direction, and both of them are pretty decent levels. So this person, this top example, has a pretty decent cortisol curve and decent cortisol levels. When I come down here, these are 2 different patterns of flatlined cortisol, where they're not getting, they're waking up too low, they're not rising, they're just flat the whole day. Both of these people probably feel fatigued. Both of these people might be labeled as adrenal fatigue or adrenal insufficiency. But we know on a Dutch, a lot of this is not adrenal insufficiency, because this top pattern, you can see they're making loads of metabolized cortisol. So what's going on here versus this bottom picture where they're not making any? This would really be, this bottom patient 2 here would be like an adrenal insufficiency. 80% of the cortisol made is too low, plus the free cortisol is too low, and they don't have the cortisol kind of pattern that they should have. So this might be, I'm thinking about all the things might be suppressing adrenal function. Certainly could be hypothyroid, a low functioning thyroid. Certainly could be medication. So steroids can do this. A brain injury could do this, like a concussion or a traumatic brain injury of some sort, where you're just, that whole HPA system is not working well. So again, I'm trying to figure out what it is. Also, some of the opioid meds can do this. So again, I want to try and figure out, someone like me is like a bit of a medical detective. I'm trying to kind of work through all the different clues I'm getting through the objective data points with their signs and symptoms, and figuring out what's going on root cause. So this picture where I'm flatlined for my free cortisol, but I'm making tons of metabolized cortisol, this could be an overfunctioning thyroid. This could be inflammation. It could be blood sugar. It could be, so a lot of the things that are, it could be like a toxic load. And so, the liver is having a hard time. It's not clearing stuff properly. So you have too much metabolized cortisol because your liver can't break it down properly. It's not clearing stuff well. So again, these all give me clues. And then this last pattern might be someone like who's a rheumatoid arthritis patient who's having a flare, where maybe the body has decided in its wisdom that it wants to have high levels of cortisol to help them kind of in the short term get through a really inflamed period of time. So this is where I'm looking at really high free, really high metabolized, really like the adrenals are just churning stuff out. And maybe then they have too much, and then maybe they're not sleeping at the right time because they have high cortisol at night. So again, this Dutch panel is really amazing at figuring out giving someone like me very objective cues that I then can kind of work through what's actually going on. Okay, so testing is essential, and again, gives us amazing insight into what's going on, both from a sympathetic, that's like your fight or flight system. How much stress hormone do you have coursing through your body at any given time? And then we also want to think about, do we have any of the rest, relax, restore in our lives? So most people, modern day living, it's a modern day problem to be in a chronic sympathetic state. I have to speak to almost every patient about, okay, let's talk about how we bring some parasympathetic into your life. So ideally, we're doing that daily. So I want people to think about, so for everyone listening, think about what tools do you have in your toolbox that put you in rest, relax, restore mode. A lot of patients will tell me they exercise and that's kind of their relaxation, which can be great. But if your exercise is more like your heart pumping, like really moving exercise, that is just not a parasympathetic activity. So like HIIT classes, more intense cardio, weight training, they're all amazing. We absolutely want to be doing them, but that shouldn't be your parasympathetic activity. Drinking a glass of wine, alcohol also should not be your parasympathetic activity. So we want to think about things. So I've kind of written a list here of just different things to start to think about. Can you bring some of these things into just your daily life? Breathing, meditation and mindfulness, maybe journaling, more gentle exercise. So things like walking, things like gentle yoga. Kind of more intense vinyasa yoga is not going to be a parasympathetic activity. Putting down our screens and devices. A lot of us are living in chronic stress states because of kind of the screens and device world that we live in. Connecting with other people that we just feel like good being around. We feel like we can like really be authentic and really be ourselves. Like community can be very, very parasympathetic. Intimacy can be an amazing parasympathetic activity. Being outside in nature, like everyone feels when they go for like a walk in nature, it just can help them de-stress and deload. And that's because it just brings in a really nice parasympathetic. Reading a really light book, most people, I tell them when they're, before bed is not the time to read like a heart thumping book. You want to help bring yourself into parasympathetic because you shouldn't have tons of stress hormone kind of coursing through your veins as you're going to bed at night. Is when we want cortisols nice and low. And really like anything that just makes you feel relaxed and like gives you joy. So for some people that's cooking, some people it's gardening, some people it's taking a relaxing bath. Some people it's just like talking to a friend. So, anything that just makes you feel good and then just calms you out of that sympathetic state is really important. Ideally, you're doing that at least once a day. Like, let your nervous system experience parasympathetic. Okay, so let's go into thyroid. So I'm warning now, it's going to go over a bit because I know we were 15 minutes late starting. So thyroid hormone, I think of thyroid hormone as kind of like the gas in your car. It makes everything go. It helps metabolism move. It helps the bowels move. It helps mood and energies move. Like we need thyroid hormones help regulate metabolism. So which is a conversion of oxygen and nutrients into energy. So in order to have enough energy for life, we really need thyroid hormone to be working. So brain kind of monitors levels, talks to the thyroid, tells it to make thyroid hormone. We test TSH in our blood. We can test the free levels of T4. We can test total T4 also. I find free T4 a much more valuable marker. So I want to know, how loudly does the brain have to yell at the thyroid to have it make thyroid hormone? Is the body then making enough free available level of T4? And then we have to convert this inactive or storage form, this precursor of active thyroid hormone of T4 into T3. A lot of that happens outside of the thyroid. So the liver plays a role, the gut plays a role. So those become really important in thyroid conversion. So nutrients like zinc and selenium are super important. Iodine is super important for thyroid to work properly. So every cell in the body is dependent upon thyroid hormone. So when we have an underfunctioning, when we have low thyroid hormone, sometimes we can't make enough hormone and sometimes we can't break down our hormones properly. So again, there's a big overlay here, this weaving together of how one hormone interacts with the other. So thyroid is kind of one of those things. It's a bit of a deal breaker if thyroid doesn't work properly. We got to get thyroid right. Just like we got to get insulin right and we got to get stress hormone right. These are all like super important things to get right. So the common patterns we see in thyroid is an underactive thyroid, hypothyroidism. Most hypothyroid is an autoimmune presentation called Hashimoto's thyroiditis. So autoimmune means the body's attacking its own thyroid. It's often treated with giving thyroid replacement hormone. Oftentimes there's different types of thyroid replacement hormone. I'm not going to really get into it today, but I do a whole talk on thyroid. And, I'd say probably half of my practice has some type of thyroid hormone. It's really, really common, especially for women and especially after pregnancies. It just almost feels like it's like epidemic, so many women, but a lot of men too. A lot of men I treat also have thyroid issues. So you can also have an overactive thyroid, hyperthyroidism. Oftentimes, this is also an autoimmune presentation. Neither of these are always autoimmune, but oftentimes they are. So the autoimmune presentation of hyperthyroid is called Graves' disease. And it's treated usually either with medication. Sometimes someone gets part of their thyroid removed. Sometimes part of the thyroid is destroyed through radioactive iodine. So there's different strategies there. And then in general with thyroid, whether it's autoimmune or not, we want to just assess and identify and then treat whatever is going on that's underlying. So genetics sometimes play into it. Gluten is a really big deal with thyroid. Pretty much for me, anytime if someone has a thyroid, especially if it's autoimmune of any kind, I always, probably the best nutritional strategy that I find is to completely cut out gluten. So I usually tell people just kind of start to embrace a life without gluten, and there's really great ways to do that. So working with, myself or someone like me to help you understand why and help you kind of implement that can be really helpful. Certainly estrogen dominance, too much estrogen can play a big role here as an underlying driver. Pregnancy can often, for whatever reason, be a trigger because of the way that the immune system shifts during pregnancy. It can kind of trigger something that oftentimes ends up being autoimmune thyroid disease post-pregnancy. We want to think about stress and infections and chronic inflammation and nutrient deficiencies. So again, like the gamut of things, insulin again can play into this. So we got to get thyroid right. Let's go into sex hormone. Thinking about estrogen, progesterone, testosterone. This is a huge topic. It's very well assessed on the same Dutch panel that's going to look at your adrenals. So if you think you have hormone issues and you can afford to run one test, the Dutch panel is going to be your test, and you're going to overlay that with some blood work. So looking at your blood work around insulin and maybe liver and some of the nutrient deficiencies that we'll talk about. So that would be kind of a good place to start. So for females, when I'm thinking about sex hormone, I want to think about their monthly menstrual cycle. And is that happening appropriately? Are they getting the right hormone surges at the right times? So I work with a lot of women to track their cycle and learn their cycle and look objectively at their cycle and then adjust their lifestyle around their cycle. So I think if you can start this in your teenage years, I do a talk kind of hormones for mothers and daughters. And a lot of this is about learning how to live your life according to your cycle. So eating in a way that supports your cycle, moving and exercising in a way that supports your cycle, thinking about just, there's certain times of the month, like week 2 of our cycle, when we get our testosterone surge, is like a really great week for women. Women can feel really good. Certainly, like we usually get a libido spike during that week. But besides that, there's a lot of like confidence that goes along with that. So like, if you want to ask for a promotion at work, or if there's like, something big that you have to do, week 2 is a great time to do that, because women tend to like feel good and they look good, and just the way the hormonal landscape looks during that week. It's a really great week for women. So again, if you can learn your monthly cycle and learn to work around that, it can be incredibly empowering. I kind of talk about it as like it can be your superpower. Okay, so think about, again, menstrual patterns are not firmly established until our late teens or early 20s. So lots of girls end up thinking that they have hormone problems because at 14 or at 15 or at 16, they're not having a full and normal cycle. And, maybe some months it's really heavy, some months it's really light, maybe it's irregular. A lot of these girls are getting put on the birth control pill. And it's, in my opinion, if you're not using it as birth control, you want to give the body the time to establish this hypothalamic pituitary ovary axis, this HPO axis. Girls need time to establish this, and you really want to let that happen naturally. And if there are, so a lot of girls are also put on the birth control pill in their teens for acne. So I would say really look at and identify what those underlying drivers are and work with those first. So I have another slide on birth control pill. I'll talk a little bit more about that, but there's probably better ways. Even if you're going to use it as birth control, there might be better options that aren't so disruptive to our cycle. We also have to think about, for women, that perimenopause into menopause years. So what's really important is, as the ovaries slowly go into a retirement from the mid-30s to kind of the late 40s, early 50s, and women move into menopause, the adrenal glands play a much more important role. So the adrenal glands take over whatever sex hormone production you're going to have once the ovaries go into retirement. So if you don't take care of your adrenal glands, if you're burning the candle at both ends in your 20s and 30s and 40s, it becomes really hard when you get to menopause. So we really want to give our adrenals and get our stress hormone regulated and get those kind of lifestyle pieces dialed in. So healthy kind of stress and bringing the parasympathetic in, just it happens in a healthier way. We also might think about hormone replacement or fertility issues or different treatments there for women. And so again, working with a practitioner like myself or someone who treats in a functional model can be really helpful for the individual woman trying to balance these. And then we have to think about hormone breakdown and metabolism for both men and women. So again, I'm going to show you on the next slide, where we go through the Dutch panel, kind of these important things. So whether it's for men, whether it's for women. So for men, we're certainly thinking about also hormonal surges in teenage years. We have to be able to make the hormones, and we have to be able to break down the hormones. So again, if we're seeing major hormone fluctuations, I find a lot of the teens that I work with who are maybe having like really big mood swings or lots of acne or just issues around hormonal surges, they can really be helped sometimes by just bringing in the things to help us break down the hormones properly, and then looking at what's behind the detoxification issues. Certainly thinking about testosterone issues for men. Do they have enough? Do they have too much? Are they breaking it down? So both men and women, we need to look at how they're breaking down their testosterones. If we break it down the wrong pathway, for men, we might lead to like male pattern baldness and some of those issues. with breaking down testosterone the wrong way. And for women, we often end up with what's called PCOS. And then for men, they need some estrogen, but we certainly don't want too much estrogen, or else you end up with man boobs and other kind of estrogen dominance stuff. Sometimes we get like weight around the middle. We also, especially for the adult men that I treat, modulating stress can be just such a major piece of normalizing around, especially testosterone. So we have to kind of, also for women, but that's a big focus when I work with men. So the Dutch panel is just so important to look at, to get a sense of what's going on with your adrenals, what's going on with the levels of your sex hormone, and how are you breaking down your sex hormone. And other hormone drivers are the same things that, again, this like interconnectedness of all these hormonal patterns. We got to get insulin right. We got to get cortisol and stress hormone right. We got to get thyroid right. We got to get detox right. We got to get gut right. Okay, so the symptoms men and women have when they're kind of hormonal can be slightly different. Women might have more menstrual, might have more, vaginal issues, might have more kind of hot flashes and night sweats as they're moving into menopause, might have weight gain in a different way, might have sleep problems in a different way. But again, a lot of these hormonal type symptoms can be kind of universal between men and women. Mood issues can go for both, irritability. Men are obviously going to have more of like prostate issues, and women are going to have more kind of like vaginal, menstrual type issues. Men are going to have the erectile issues, potentially. Men tend to get more of the male pattern baldness, hair loss, but some of the women I treat have that as well. Cognitive decline, memory issues, kind of brain fogginess, that's kind of across the board. Weight gain, loss of muscle mass across the board. So a lot of these things can be indicators of hormonal dysfunction. Okay, so this kind of pink colored chart here is going to be kind of the normal surges of starting out early cycle with follicular stimulating hormone, FSH, stimulates the follicle in the ovary. We get a nice estrogen surge coming up at the beginning of our cycle, and we get follicular stimulating hormone at the beginning of our cycle. Estrogen kind of comes to a peak around ovulation, where we get this beautiful rise of luteinizing hormone, which kind of stimulates the ovary to release the egg. And then you get a drop in that. FSH, you get another little peak here. Estrogen starts to go down, and we get a second rise a little bit later in the cycle. And then progesterone really plays no role in the beginning of our cycle and plays a major role to help us build this kind of beautiful uterine lining in the second half of our cycle. So if the egg does get fertilized, it can implant into this nice kind of juicy uterine lining. So that would be kind of a normal cycle. This chart here is just looking at kind of over 6 months. We want someone who's cycling normally will look like this. This is how we start to look. This middle chart is how we look in perimenopause, which is, I think, how a lot of women can feel during perimenopause. Their hormonal surges are all over the place. So a lot of women, as you get to, sometimes it starts, early 40s. A lot of the time it's kind of from like mid 40s to early 50s. Women are kind of all over the place. It's super hard to track your cycle. So I thought this is just like a good, diagram to help understand why perimenopause, it's like the brain, sometimes it's communicating, sometimes it's not, sometimes it's screaming, sometimes it's barely talking. So you get all sorts of these crazy fluctuations during perimenopause that can drive a lot of the symptoms for women. All right, so let's look at the Dutch panel here. The Dutch panel, what's really important here is we want to look at the levels, and then we want to look at how we're breaking things down. So we can see on this panel, the progesterone is really low. And we usually, on cycling women, we do this test during about 5 to 7 days after a woman ovulates, during the luteal phase, when progesterone plays its big role. Progesterone should be like at its peak there. So we know this woman has super low progesterone. And we look down at the androgens, the DHEA, testosterone, so super low here. But the way this woman is breaking down her androgens is to this like super testosterone. This, when we prefer this 5-alpha pathway, this looks like a PCOS patient where we get, so, and men who have a lot of like the male pattern baldness are going to prefer this pathway. This dihydrotestosterone, this pathway is like a super testosterone that we need some of it. We want some of it. We don't want none of it, but we want to be in normal ranges for us, according to this kind of age-dependent ranges. And we do not want this preference so strongly of this 5-alpha pathway. We want it much more balanced. These androgens, the male kind of sex hormones, through a process called aromatization, turn into some of the estrogens that we have here. And so you see this woman is like super estrogen dominant, so much estrogen. Estrogen dominance is too much estrogen in comparison to progesterone. So this woman is very estrogen dominant. And then what I think is probably one of the most important parts of the Dutch panel is how you're breaking down your hormones. You need to take all this hormone, and ideally we're breaking down most of it down this 2OH pathway. This is the protective estrogen pathway, which this woman is not doing well. So she is not detoxing her estrogen well. Ideally, I want about 2/3 of this pie chart to be green, and she has, less than 50% is green. This is the most damaging probably of all the estrogen breakdown products because it can lead to damage in DNA, which can drive a lot of estrogen-driven cancers, which are quite common. A lot of breast cancer, there's a lot of estrogen-driven cancers out there. So we absolutely want to get this right. This woman, her amount down the 4OH is not too bad. And we can mitigate if someone does have a strong preference for this 4OH pathway, we can mitigate that by making sure they're doing part of the detox process called methylation and making sure they have enough glutathione, which is a really important antioxidant. This pathway, the blue pathway that this person has a lot of, this is a more proliferative pathway. So in the context of 16OH, this estrogen breakdown product, this like helps tissues grow. So this woman might end up with fibroids, endometriosis, cysts. It's like fertilizer to help tissues grow. So we want to normalize this estrogen breakdown and the testosterone breakdown. And we want to bring up progesterone. We want to bring up the overall load of androgens once we've fixed the way they're being broken down. And then this gives us a sense, are they actually methylating? Is part of phase 2 liver detox happening properly? In this person, it is not. In order to methylate, I know I need certain B vitamins. In order for this gene, COMT, to work, I know I need magnesium. So I'm already thinking about how can I support this person through nutrients and through detox support so they can break down. So this becomes a toxic load. When we are not breaking down our estrogens properly, it becomes a toxic load. We need to make hormone, we need to break down hormone. Okay. Sometimes also, just real quick, if we have really low levels of everything, sometimes you'll get an upswing of cholesterol in the blood. And that's because cholesterol is the backbone for our sex hormone. So sometimes the feedback that the body gets when we have really low levels of hormone is make more cholesterol, because that's going to potentially help us make more sex hormone. Doesn't always work, but it is somewhat common, especially as women are getting closer to menopause and maybe hormone levels are dropping, that we might see an upswing for women in a blood test for cholesterol. I know we're getting close to 11. I'm going to keep talking and going through the talk. For those of you that can stay with me, please do, and I will answer questions at the end. For those of you that have to go, know that you're going to get a recording of the talk. So, if you have to go, thank you so much for joining, and just, log out as you have to. And big apologies for starting late. This is the very first time I was doing this, the technical piece on my own. And, unfortunately it didn't go so smoothly initially, but I'm glad we got going. Okay, so back to hormonal birth control. So one of the biggest problems with hormonal birth control, the birth control pill, the patch, the implant, the injection, the ring, is that it stops ovulation. So it stops the FSH and the LH surges from the pituitary. So we just don't ovulate. and you don't then get your proper progesterone production. So it's one of many different birth control options, but oftentimes it's the one that, because we're telling the brain, shut off the communication, it's the one that I find that can have the most long-term negative effects, especially when we're thinking about fertility. I'm not saying there's not a place for the birth control pill. I think if you do decide for yourself or for your teenagers to have them go on the birth control pill, you want to go into it with your eyes open. There's a really great book by Dr. Jolene Brighton. She's an American naturopathic doctor. She wrote a book called Beyond the Pill. At least understand what's happening. Think about the long-term consequences. Consider taking breaks. I definitely don't recommend. So I know, myself and probably a lot of people in my generation, I'm in my late 40s now, were on the pill in their teenage years, were on the pill for a lot of their 20s, and just didn't really think about it. So thinking about, are there other either non-hormonal options or just other options that we can consider? There are hormonal IUDs like the Mirena. I find a lot of women post having children go have an IUD put in, and it suppresses ovulation to a certain extent, but it oftentimes doesn't completely stop ovulation the way the birth control pill does. So women who have a Mirena can still do a Dutch, because we still can get a lot of information. A little bit harder when you're on the birth control pill, because just everything, all your hormone levels are suppressed, because you're giving synthetic hormone. So you're not getting to see that natural cycle of hormones. It can be helpful potentially for looking at, your adrenals still, your sleep hormone, maybe some of like your detox of hormones, but we don't get to see as well because you don't have normal hormone production. Think about fixing hormones without using the birth control pill is my strong recommendation. So for women, either thinking about kind of going off the birth control, certainly giving yourself a nice break before you think about having babies. 6 months would be amazing. At least 3 months would be, okay. But think about maybe working with someone to like get a really good assessment of your hormones and then working on them. There's also non-hormonal options like the copper IUD, fertility awareness methods, certainly condoms. Someone's trying to use it as birth control. So, but just kind of, again, just going into birth control with eyes open, knowing what you're doing to your kind of hypothalamus, pituitary, ovary axis. A little bit just on teens. So again, stressors around teens, thinking about school, thinking about social. The Dutch panel can be really great, especially in like the slightly later teenage years where the hormones are becoming a little bit more established. Acne can be a big issue. Skin's a detox organ. So I'm going to talk a little bit about detox as well, but skin's a detox organ. So if we're not breaking things down through our optimal detox organs, we can start pushing stuff up through the skin. Certainly dairy can play a big role in facial acne for teens. So potentially thinking about removing dairy if your teen has a big acne issue is absolutely worth a try. It can be a really good nutritional strategy. Menstrual issues for females we need to think about. Again, we want to assess and then we want to treat accordingly. Depression and anxiety can start to be a big deal for kids. We absolutely want to think about gut here. We want to think about adrenals here. We want to think about nutrient deficiencies. A lot of depression and anxiety is being driven by inflammation. So then we need to figure out like, why are they inflamed? Are they inflamed because of insulin issues? Because they're eating foods that don't work for them? Because they have, other types of underlying issues. So we want to just figure out what's underlying it. And then we want to balance the main hormones first and see what happens. Get your insulin right, get your cortisol right, get your thyroid right, get your sex hormone right, and take an objective look and figure out really what's going on. Okay, so nutrient deficiencies, gut is a big thing here. So are we having nutrient deficiencies because of gut issues or is it because of poor diet? Oftentimes it's both. So in order to make hormone, in order to break down hormone, we need certain nutrients. We need certain vitamins and certain minerals and certain fats and certain amino acids and certain antioxidants. So looking objectively at your B vitamins, your vitamin D, your vitamin A, your magnesium, your zinc, your selenium, your omega-3s. Is someone eating enough protein? Do they have enough amino acids? Are they getting their antioxidants they need? Is their glutathione system working? So a lot of the time there's indications on either the blood work or the organic acids portion of the Dutch test, or maybe a separate organic acids profile that I'm running as to what's going on here. Also just someone like me going through their diet, like talk me through your diet, what's going on in a given day or given week. It gives me a good sense. Most people are far under eating protein. So getting protein right is essential. We have to get protein right. If you want to hear more about that, Dr. Gabrielle Lyon, Lyon, is an amazing resource. She's done loads of podcast interviews. She has her own podcast as well, just to understand the importance of protein to have our bodies work properly. So we've got ideally we're eating a good nutrient-rich diet and getting some in from that. And then maybe we have to supplement. Okay, so gut and digestion, we got to get gut right because one, it's a major part of our elimination system. And two, it's a major part of our nutrient absorption system. The gut microbiome also regulates a huge percentage of our immune system. It's hypothesized as like up to 70 to 80% of our immune system is regulated by what's going on in our gut. So when we're thinking about infectious load, toxic load, we got to get gut right. So we got to eat the right things, and we've got to deal with infections if there's infections in the gut. We've got to work on gut permeability or leakiness if it's there. So gut permeability basically means you can think of the gut as a tube, maybe a hollow tube from one end to the other. And that tube, what's happening in that tube should not be mixing with what's going on in the bloodstream, which is right outside. So if this is the inner part of the gut, we've got kind of the gut cells here, okay? So here's the inner tube. If these two gut cells do not have these nice tight junctions and there's these little micro tears here, now things that are maybe even normal and healthy in the gut can find their way out of these little gaps or leakiness into the bloodstream, and you have a host of immune cells waiting on the outside, ready to mount a response. So we certainly don't want our broken down parts of fats, carbohydrates, and proteins finding their way out of the gut into the bloodstream. That's how we end up with food intolerances. We also don't want, parts of, toxins that bacteria let out. We don't want them in the bloodstream. We don't want other normal things, whether it's like the good healthy bacteria or toxins or food particles or bacteria, all those things, if they find their way out of the gut, they cause all sorts of kind of immune system cascades. So that we want to fix. We can look at that quite nicely. If there's a gut leakiness, there's a marker on the GI map, which is my favorite advanced stool panel. It analyzes your stool via DNA PCR analysis and tells you in a very precise way what overgrowths you have. And it looks at all these different intestinal health markers. Do you break down your fats properly? Are you making enough digestive enzymes? Is phase 2 and phase 3 liver detoxification working well to help you break down, you think, something like your estrogens? Is your immune system in your gut normal? How inflamed are you? And is your gut leaky? So this marker zonulin in this sample is high. So we know there's a high degree of intestinal permeability or leaky gut. This person also has high levels of C. difficile, two really nasty toxins and bacteria that just should never be there. All these guys are the guys that never should be in the gut. Whereas a lot of these guys, here we have our good healthy bacterial flora. This is, again, just still on the GI map. Here we have fungi, yeast. Here we have parasites. We have virus. We have Helicobacter pylori. We also look at a whole slew of bacteria that I think about as like the weeds in the garden. So it's okay to have some weeds in the garden, but if those weeds in the garden are taking up the space of your healthy plants and flowers, it's just not good. It's, you have imbalance in your gut. All right, so let's go into kind of our final section before we go into kind of what to do about all this. Just thinking about, and I've alluded to detoxification a lot because we have to break down our hormones properly. So thinking about, is the liver working well? Is the gallbladder working well? Are the kidneys working well? We want to make sure we get phase 1 and phase 2 liver detox working well. Toxin has to come into the liver, be broken apart into its component parts. Then it has to be packaged up quite nicely to a safe little bundle that if the gallbladder is working, it helps, we have enough bile to get things out. It goes out through the gut, and we think about that as like our phase 3 liver detox. And we need the gut working properly, and we need to eliminate it. The fat soluble stuff is going out through the bowels. The water soluble stuff is going out through the renal system, through the urine. So the skin and the lungs are also detox organs. So I already said this before, if your liver, if your gallbladder, if your kidneys, even if your gut are not working properly, things can get pushed out through our skin, and we can see eczema, we can see acne. So we want to get detoxification right. And there's lots of objective ways to look at this. So within the functional world, we want to just really assess and get detox right. There's lots of nutrients you need in order to detox. In order to do phase 1 liver detox, to break apart the component parts, we need a lot of vitamins and nutrients, vitamins, minerals, antioxidants. So we need to get our B vitamins, we need our glutathione, we need some of our fat soluble vitamins, we need vitamin C. And then in order to get to package everything up into this nice little boxes, we need amino acids. So this is where our protein is really, really important. So we need amino acids, and then the cruciferous vegetables and the alliums become really important. So eating our cruciferous, like our broccoli, kale, cauli, Brussels, that kind of stuff. And then our alliums, like our onion, garlic, shallot, leek. Some people with gut issues can't tolerate these. And then we need to, maybe think about supplementing. Oftentimes we need to think about supplementing anyways, because if someone has a major detox issue, sometimes you can get there food-based, but it might take you like 10 years. Whereas you could just supplement in the short term and you could get there a lot faster. So food-based eating is an amazing way to just for maintenance, when you need maintenance levels. When you need therapeutic doses of something, it's always my recommendation to supplement short term and just get what you need in the short term to help push a biochemical process that you might not be doing properly. Just a quick slide on alcohol. I think, this podcast by Andrew Huberman was apparently the second most popular podcast in the world in 2022. What alcohol does to the body, brain, and health. It's on his podcast called Huberman Lab, which is a really amazing research. Dr. Andrew Huberman, he's a neuroscientist at Stanford, and he's just like, he pulls together the scientific literature really beautifully. So his podcast on alcohol is really a must listen to understand what it does to our stress responses, what it does to our brain health, what it does to our hormones and our sleep, and from a toxic load perspective. I find that especially for women, as they move into their perimenopausal years and closer to menopause, and for men also as they move kind of into their 40s and 50s, it becomes really important to think about and modulate around alcohol. And again, listen to the podcast, and it should tie in beautifully to everything that I'm saying here. And it'll give you a good understanding of why it's so important to get alcohol consumption right. And what's right for one individual might be different than for another. It's always like, what do you have going on? But for everyone, there's going to be a line that's going to be too much that is going to take you down from, maybe a toxic load perspective, maybe a stress management perspective. Okay, so other things to think about from a toxicity, which can affect hormones besides alcohol, there's all sorts of things that just are called endocrine disruptors. So those are going to be a lot of our plastics. So much female beauty products and makeup is just full of endocrine disruptors. Women are generally like lathering themselves all day, every day with chemicals that disrupt our hormones. So think about switching to clean beauty products. I have a couple of brands I love, so you can always reach out to me if you want some recommendations, but it's really important. There's no regulation in the beauty product industry, so you really want to kind of find a reputable source that makes clean products and just start switching over. Get rid of all the plastics. Certainly never heat anything in plastics. Switch to glass, switch to stainless steel. Just not as much of hormone disruptors. Mold and mycotoxins are a really big deal in hot, humid places. Singapore and Hong Kong definitely fall into that category. I treat a ton of patients with mold and mycotoxin problems. Heavy metals can be an issue. Environmental toxins can be an issue. So again, there's very objective ways to test all of this. So if you think this is a driver for you, work with someone to really assess properly. Okay, so for the last few minutes, I'm going to really just talk about what can we do to support our hormones. Ideally, we want to start with diet because we eat all day, every day. It is such a big deal to get this right. Okay, foods that we might be eating that are hurting our hormonal system. All the packaged, processed, highly refined foods and too much processed refined sugar. So we want to get rid of that. And our plate should look more like this, just whole foods. Eat whole, real foods, proteins, lots of veg, good healthy fats, a little bit of fruit, especially the berries, maybe pomegranate, nuts and seeds, a lot of like our carbohydrates in the form of these starchy tubers. Some people can absolutely do whole grains. That's kind of dependent on what you have going on. I think a lot of women in particular, from a hormonal perspective, do quite well on low to no grains, but some women really feel better with a little bit of like, organic brown rice or quinoa or millet or buckwheat. So when I think about creating a treatment plan, I really think of this multi-pronged approach to fix really what's underlying for the individual that I'm working with. So as a generalization, diet is like, I think about it as like the foundation of the house. It's very hard to build a good house if you have a shitty foundation or a suboptimal foundation. So because it's what we do all day, every day, we got to get diet right. So we want to eat a whole food, nutrient-dense diet. We want to, as much as we can, eliminate inflammatory and toxic foods, avoid the processed refined sugars, grains, and oils. So all the vegetable oils like your canola, your sunflower, your safflower. You want to really focus on things that like extra virgin olive oil, avocado oil, grass-fed ghee or butter if you can tolerate some dairy. So think of like those are, and coconut oil is a great one. So those are kind of like the main fats and oils that we want to bring in. We want to mostly get rid of the rest of them because they're just really inflammatory. They're high in omega-6. We want to focus on quality of our food. So buy just good, clean food, ideally without a lot of pesticides, herbicides. Certainly we don't want our meat and our dairy with hormone steroids and antibiotics. So think about quality. And again, you can work with someone like me to help you think through if you have budget constraints. Because there are ways you can do this on a budget. We want to individualize our carbohydrate intake based on what's going on blood sugar and insulin. We always want to eat good quality protein at each meal. Again, the vast majority of people are under eating protein, which is why so many people as they get older end up weak and frail. We've got to build and maintain muscle mass. It's essential. So we have to get our protein right. You don't want to overeat protein, but you certainly don't want to undereat protein. Eat plenty of good healthy fats and lots of veggies for each meal. I try and have people do kind of even a half to 2/3 of their meal should be various types of vegetables, different colors, eat the rainbow, try and get in, each color has different nutrients. So we ideally want variety. We don't want to eat the same things all the time. So I'm going to, adjust this according to the individual. There's lots of nutritional strategies. So, let's work with someone to find the right ones for you. Maybe it's fasting, maybe it's keto. You certainly want to keep hydrated and think about maybe adding in electrolytes, especially if you're feeling like you're retaining water. Adding in electrolytes can be a really great way to help people with this. We want to maybe detox, but only when the body is ready. I do a whole talk called Demystifying Detox, which talks about when to know if you're doing detox in the right way for you and how to do that. You want to just support the detox organs. We want to clean up and support the gut. We want to support any nutrient deficiencies. We want to support any other systems that need supporting. We want to get our sleep right, our exercise right, and our community. We want to feel like we have a community that supports us. We want to get our stress management strategies right. And I try and have most people do like a 12 to 13 hour overnight fast every night. And ideally you stop eating at least 2, ideally 3 hours before you sleep. Those are good, like low hanging fruit stuff to add in. Exercise and movement from a hormonal perspective and just a general overall health and wellness perspective, weightlifting and resistance training are really essential. I love it when I get women who come in or men who come in like their 40s. And I'm like, oh my God, this is so important. You have to start building muscle mass. Women in particular, before they lose a lot of their hormones in menopause, you really want to get this right because it's just so much easier to build muscle before you lose your hormones or a lot of them. You want to move daily. Maybe that's walking. Maybe that's if you're someone who does well counting your steps and using that as a goal. You want to move. Daily movement is essential. We want to think about adding in the parasympathetic movement, potentially the stretching, the yoga, the gentle walking. That can be a really great way. And then we also want to add in some cardio and some high intensity interval training throughout the week or the month. And you can pin that to your cycle for women, but we want to get some of that in, but we want to build and maintain muscle mass. So I want to think about supplements and herbs, and this is, again, very individualized, but here's a few basics that most people need. Omega-3s, magnesium, vitamin D, your B vitamins via a B complex, get the whole array of Bs for most people in their active methylated form, probiotics, electrolytes, and greens. And then anything else is going to be very specialized. Just to know, just like the beauty product industry is not regulated, the supplement industry is not regulated. There's amazing brands out there, and most of them are not great. So again, if you want some recommendations on brands, there's a couple of good things on iHerb. At Balanced Living, I bring in all just really high-end, amazing supplements. So we have a great dispensary here. People who are living in Singapore, you can certainly get those from here. And then again, just reach out to me if you have, if you want recommendations on brands or where to buy. And just last note in summary, kind of when we're thinking about hormones, know and respect that there are circadian rhythms and try and live your life and make lifestyle choices to support those rhythms. So a lot of hormones happen in these kind of rhythmic cycles, sometimes daily, sometimes monthly. Make lifestyle choices to support your hormones. We got to get diet right. We got to get sleep right, stress management, exercise and movement, and try and eliminate as much toxic exposure as you can. Control what you can control. Buy cleaner foods. Get like the toxic chemical cleaning products out of your house. Don't dry cleaning using toxic stuff. Like there's some low hanging fruit that's quite easy to change. Make sure your water is filtered. Don't let your body be the filter. Filter it before you drink it. Lifestyle changes happen faster than we think. So it seems really hard and difficult. And sometimes it is hard and difficult, but if you're someone who needs more handholding, then you work with a practitioner. There's some amazing practitioners, in Singapore. And I know there's a lot of people tuning into this from outside of Singapore. So again, if you feel like you need someone to hold your hand through these changes, find a functional medicine practitioner, find a health coach, find someone who can do this kind of with you. Do it with a friend or a family member. So that for some people, just having that kind of community support can be really important. Run your lab tests, know what's actually going on. And then again, get supported by someone if you need to. So that's it. Thank you guys so much. Sorry we ran a little bit over, but again, we started kind of 15 to 20 minutes late. I appreciate you all being here. Here's my contact details. Reach out. I'm on email. You can WhatsApp me if you have questions. And I hope that this kind of, again, wove together a little bit of a hormonal story for you. I'd love to get feedback, truthfully, about this class or about this webinar, because again, this is the broadest class I think I've ever done. And just, yeah, give me a sense. Did it come together for you? Did it feel too broad? Was it, again, I do lots of classes that are deep dives into lots of pieces of this. Yeah, I just would love to hear feedback. So thank you again. Let me just see if there's any questions, put them in the chat box. What's the role of saturated fat in insulin dysregulation? So saturated fat is a little bit of a kind of a nuanced conversation. A lot of people talk about it with regards to cholesterol, which we know kind of the old way of thinking about it is not absolutely, it's not the right way to think about it. There's we know from kind of newer, better nutritional science that there's different ways. When I think about saturated fat and insulin, truthfully, a lot of the time when you eat good, healthy fats, and some of those are saturated fats, in the context before your carbohydrates or with your carbohydrates, oftentimes it can slow down the uptake, like how quickly that glucose comes into the bloodstream, just like fiber can, just like protein can. So oftentimes it can help us with our insulin or blood sugar dysregulation. But again, it's a very nuanced question that really probably requires me taking a look at an individual's kind of diet and an individual's lab test. But I hope that was somewhat helpful to answer that question. There's another question here. Is it okay for teens to take whey protein? Whey protein can be an awesome protein powder. So I have a 14-year-old son, and he doesn't do amazing with dairy. I run his genetics. I know he doesn't break them down as well. I know that he has some issues with dairy, but he does do, so whey is a protein that comes from dairy, but a lot of people, when they're reacting to dairy, a lot of people react to either the lactose, which is the milk sugar, or to casein, which is the milk protein. So depending on what you react to, a lot of people who do think they have dairy issues do really well with whey. It's an amazing protein when you're trying to build muscle. It's my favorite protein. Like any day I lift weights, I will always have protein powder. So the 3 days a week I do weight training, I will always have whey protein within the first hour to 2 hours after I finish lifting. It's very helpful for that. So I love it for teenagers as long as they don't have a major dairy problem. I also find it's a great way, especially our growing teens. A lot of them need a little bit more calories and a little bit more fuel. So adding in kind of a good nutrient dense protein shake can be a great way to do it. I also love it for breakfast. Like my son sometimes leaves for football practice at like 6 a.m. And so my helper will make him either the night before or that morning, like a good quality protein shake that he can have right after training before he starts school. And he just carries it with him to school. So it can be a great way for teens, either, if they have early morning practices or after school practices, or they want a good nutrient dense snack when they get home from school. Generally, I want protein, I want fats, and maybe some like frozen organic berries in there. So the fats might be adding in like avocados. It's very easy to add fiber in there. I'm adding lots of vegetables into the Vitamix or a green powder. So it's a really great, shakes are a really great way for teens and for adults, frankly. But yeah, I do like whey. Again, if your teen has an acne problem, you might want to consider a full dairy elimination for a month or two and see if it moves the needle. And then it would be cutting out whey. And in those cases, if I wanted to do a protein powder for teens, I'd be generally doing like a bone broth protein powder. So there's a great one that I have at Balanced Living Dispensary, or there's a couple of things on iHerb. But you want kind of a high protein, part collagen, part kind of almost like all the other proteins, all the other amino acid profiles that you can get from like a bone broth soup in powder form. So that's kind of the other protein powder that I really like for teens and for adults, frankly. So how to know if we're low in iron other than a blood test, how to know which iron, when one should take an iron supplement. So I look at iron through a combination of assessing ferritin in blood, which is your iron stores, plus a full iron panel. So that'll give me, transferritin, iron saturation, serum iron, plus looking at hemoglobin, which is like the school bus that has to carry iron around the body. So I'm kind of piecing together those various pictures around iron. And then based on that, I'm going to make a recommendation as to whether I think someone should supplement. I generally want someone to be on kind of a specific type of iron. Certain irons really tend to constipate, so I don't ever use those. There's some really good iron supplements, either at the dispensary at my clinic, at Balanced Living, or at on iHerb. So there's some good iron supplements out there. And someone who has low iron can be a deal breaker for, like, if someone's really anemic, very hard for them to have kind of enough energy to do what they need to do in life. So it's one of the nutrients we really want to get right. Just as a side note, because there's a lot of mycoplasma infections, it's a kind of lung respiratory infection that's really common in Singapore and Hong Kong. I do find it's a bit of like a scavenger bug. It tends to like eat up a lot of our resources. So for people who have who are really struggling to get their iron levels up, check your mycoplasma levels. It's a doctor can check that in your blood. Check if there's a mycoplasma picture there, because I do find once that's treated, and there's other bugs that can do this too. Mycoplasma is not the only one, but it is a common one that I find with iron. And, again, there's other things that might be contributing to not being able to get iron up. Some people do also have the thalassemia trait. So you want to kind of know if you have that, and then you might have to work a little bit harder to get your blood levels back. Good. So I think that was all the questions. So thank you all so much for everyone who stayed with me to the end. Again, apologies for the beginning technical difficulties, but you will get a recording and reach out to me if you have questions. Okay. And I'll be back probably after the summer with my next webinar. All right. Take care. Bye.